it'll make it easier for us then to take a closer look at them and determine whether or not those industry certs meet the qualifications that we have. So basically what we have is a rubric that we will be using to give points to the certifications. The rubric content is on the form that you will fill out. So you'll see what we're looking at when we look at those certifications. And so that's why we need you to go ahead and fill that out. And then that way, when we apply the rubric to the form, we'll be able to do that, and it'll make it a lot faster, and we'll be able to actually get through your suggestions and hopefully find the industry search that you would really have for your students. Also, just an interesting part of the industry certification that we are proposing is we are doing some certifications that are just going to be for regional work. So if you have something in your area that needs a specific certification that might not pass for the state, you can still go ahead and recommend that certification, and it would be kind of like a special program of study or a special course. We'll look at it just for your region. So I encourage you to go to that link and look at that form and try to get that filled out, whatever you would like. If you need to contact me, feel free to do that. My work cell number is on the agenda, as well as my email. So you can do either one of those. And then really the last thing on the agenda that I want to talk about is nursing education and clinical internship clinicals. But before I do that, I forgot. So also on the agenda is a link to our website. That's the wrong one. So I think most of you know how to find it. I just want to update the document. I just saw that I did not update it correctly. So if you cannot find the health science website, let me know. I think most people know where it is, so we're not going to panic over that. Okay, so about internship and nursing ed. Your CTE directors were sent a blurb a few days ago about clinicals for nursing ed, what to do. So basically, Wanda King and the nurse aid training portion of the health department emailed me and said that her director had said our students can do the clinical portion of the nurse aid training in the school setting. But if you're 100% online, that's not going to work. So you will need to figure out a way to get those students in.
Hey, Sloan, just 1 second. I might have just caught it.
Okay.
Oh, never mind. When you all sign in, just please make sure you mute. I'm trying to catch that, but I can only catch it so fast. Thank you.
Okay, so when you, if you go back to school fully online, you will have to still get those students in your lab to do your clinicals. If that is not workable for your district, if your school system or your school itself, your principal says no, then my suggestion would be not to do nursing ed this year. You all know your healthcare providers. There's nothing we can do about the virus, and there's nothing we can do about whether or not the nursing homes allow our students. So you can do your clinicals in the classroom, but you cannot do them virtually. We will open the mics in a few minutes to talk about that, but let's just go ahead. Let me just tell you the rest. What I've been suggesting to most people is if you don't feel like this is going to work out for you, you could do medical assisting. When you look at the data, there's usually more openings for medical assistants, especially in towns where there's not a hospital. There's usually lots of openings for medical assistants in towns where there are hospitals. So the medical assisting certification would not be a bad idea. It is very marketable. It's a very marketable certification. When you look at the numbers, there are as many openings for medical assistants as there are for CNAs. You could also do the nursing ed course, and you could certify your students for patient care technician. What I would do if I was going to do that or think about that, I would try to look really closely at what kind of jobs are open in my area, especially if you don't have a hospital nearby, then you would probably want to do medical assisting. If you do have a hospital nearby, then you should talk with that hospital and just look at how many patient care techs they might hire. So that's something that you're going to have to do in your district to decide which is which. And you can do both of those online. You don't have to have your students in person. So clinical internship, if you can't find clinical placements for your students, then the course really needs to be named work-based learning, and you need to use the work-based learning career practicum standards. That set of standards is also linked on the agenda that I uploaded for you. The reason that needs to happen is because we have some standards that are in clinical internship that require students to be in a clinical setting to be able to do that standard. And so work-based learning is crosswalked almost directly with clinical internship. And because you can do work-based learning without going to the workplace, the department asks that you do work-based learning if you can't get into a clinical. So we can open the mics for questions, or you can put your question in the chat and Owen will tell me what you're asking and I'll try to answer. So
Well, I'll go ahead and start. Well, Tracy, yeah, let me let you go ahead, but I do have at least 4 in the chat here.
Okay.
Okay, Sloan, this is Tracy Reisinger. If we wanted to, hey, how are you doing?
Good, how are you?
Doing good. If we wanted to do this CCMA industry certification, what course would that be related to?
Medical assisting.
Medical assisting, okay.
And the standards are already on the website, so you can see them there.
Okay, so so that would be good to go, offering starting back August. We start August 12th. We can start that class August 12th, correct?
Yes.
Okay, and then if we're going to do CPCT, that goes through the nursing ed course, correct?
It does.
Okay, that answers my question. Thank you, ma'am.
Okay, you're welcome.
Okay, here we go. So the first one that I have is, can we still do medical therapeutics so we cross more students?
Medical therapeutics is the name of the program. No, Eddie's the course. I'm so sorry. Still working on my coffee. You can. If you've had good success with that course and your students have been passing the certification test, then I'd say that's up to you. The course was written just so that teachers would have something that was more aligned to the test and with the goal of having more students pass the test. We haven't been really good at the numbers for success on that test, and that's the reason that course was written. But yeah, if you want to do therapeutics and you've been having good luck, then sure.
Okay, so the next one that we have, kind of related there, can we use the CCMA standards instead of medical therapeutics standards, or teach both in medical therapeutics class?
Okay, so it depends on what your end goal is. Blending them is going to be difficult. You're always welcome to teach more than whatever a course has in it. So if you wanted to teach therapeutics, medical therapeutics, and add in some of the standards from medical assisting, that would be fine. I don't know. Read me the question again, because I'm not sure I understand why you would want to do that. What is it? What was the question again?
Okay. Can we use the CCMA standards instead of medical therapeutic standards, or teach both in medical therapeutics class?
Okay. Well, using the CCMA standards instead of therapeutics, like I said, it depends on what your end goal is, but sure, you can teach whichever course you want. If you're looking to do medical therapeutics just in general, that's fine. If you want your students to test They'll probably be better prepared if you teach the medical assisting course. I don't know if I answered your question well or not. If I didn't, then put something else in the chat or turn your mic on and we'll chat.
Like I've also said, we do have the raise your hand function available if you want to use that. Okay, so I have two more here. The next one is, what are the chances that the CRP/BLS would be considered as an approved industry certification?
Okay, so the industry certifications are going to be in levels. This is something we've been talking about for a long time. And so I can't, without having the rubric right in front of me, tell you for sure. I'm thinking that if it passed to be on the approved list, it would probably be at the lowest level. And so the levels are going to have points, and the points are going to go toward ready grad. So I would say CPRs go, you know, if it makes it to the list. And the thing about making it to the list is kind of twofold. A, does it give you points toward ready grad? And B, can you spend Perkins money for the students? So having it on the list, I still kind of guess that it would be at the lowest level. So I can't tell you how many points it would give you. It won't give you the same amount of points as doing CNA.
Okay, you ready for the next one?
Mm-hmm.
Okay, this will be my last one that I have.
Okay.
So this year with all the questions, this year, could we look into doing the CPCT versus CCMA if needed?
Yeah, you can. So as I said a moment ago, what you need to do is look at what the needs are in your community. So we as teachers and educators are educating the workers of the state. We want our students to stay in Tennessee and work in Tennessee. And we know that a huge percentage, over 90% of the people who are in a town stay there or come back there. That's something that the census has shown us. And so we know that your students need to be able to find a job where they live. So if you do some research and you find that certified patient care tech, there are no jobs, but there are lots of jobs for CCMA, then CCMA is what you should be teaching and helping your students understand the reason behind that. But if you find the other way, there's, you know, your hospital hires tons of certified patient care techs and nobody's hiring CCMAs, then do patient care tech. But look at your local need. Did I answer that how you wanted it? I hope. Okay.
And this is Tracy Rissinger. I have one more question. Is it okay for me to ask?
Absolutely.
Sure.
Okay. I want to make sure I get it straight on the clinical internship. Because we currently have that as an offering at Warren County High School. If we're not able to have clinical placements, you're suggesting that we do the work-based learning career practicum. Is that correct?
Yes.
Okay.
Yep. And it's really, as I said, it's really the same. Years ago, 2 or 3 years ago, I crosswalked the work-based learning course standards with clinical internship, and they're almost identical.
Okay. When do you recommend, and this may be different for different districts, when do you recommend us making that decision? Because right now, clinical internship is on my books. We have students in that class, which I could easily change that in Skyward with the course code. But
right.
When do you suggest we make that decision? Because do you think clinicals are going to be an opportunity for those at any time this school year?
You know, that's the thing. It's really hard to tell what is going to happen. I know it's so frustrating for everyone. It's frustrating for me too, that we have no idea where this is all going and what's going to happen. So you might want to check around now. And if most offices, like doctor's offices, clinics, etc., are saying, yeah, we can't do students right now, my guess is, as a healthcare person, and y'all can tell me I'm crazy, if you want to, but my guess is it is not going to be better, not for a while. And so, you know, we're talking in a bit, we're going to get into flu season. And so then we're going to have COVID and the flu. And I just can't imagine that between now and December for sure that things are going to improve. And I really hate to think it, but I really don't think that in January, February, March, I don't think it's going to be that much better. So I would plan for no in-person training. And then if it happens, you want to switch it over. I mean, as long as Skyward lets you change stuff midstream, if it does, then go for it. Just to make it, you know, make that decision when it happens.
Okay. Thank you so much.
We got about 5 minutes, maybe. If anybody has a burning question, it doesn't have to be about clinicals or anything. It can be about courses or whatever.
Sloan,
Hey.
this is Gina Sipple from Smyrna High School.
Yes.
And I was considering with clinical internship, and our facility has basically told us they will let us know when they know, which I'm not expecting is there at all this year. So
right.
It'd be feasible because they've already had health science and med ther with the med ther standards. It'd be feasible to change clinical internship to CCMA.
Yes.
So that they could get certified.
Yeah.
So I can do that. Okay.
Yeah, now, I think if it were me, I would prefer to do that. You know, just a minute ago I said if you do medical assisting, you should follow it up with clinical internship.
Yeah.
But I think this is kind of the similar thing that they've done therapeutics. Now put them in assisting. You're going to have some crossover of the content, but that's okay because, you know, repetition is how you learn. Right. And so hopefully doing it in that order, they would still have a better chance at passing the test than they would if you just said, okay, we've done therapeutics, let's take the test.
Right.
So yeah, I think that's a great idea.
Okay, so another question I had is that, again, CCMA, could I substitute med ther for the CCMA class for my second years, or is CCMA a third year?
It's on the matrix, it's the second class. I know that sounds kind of crazy, but the recommendation is class 3 is therapeutics and clinical internship. And that's where you're going to take that same content and you're going to focus on that same content along the line with the standards for clinical internship. And you're going to kind of reteach, you're going to give some clinical experiences either in your classroom where the students can take a day and spend a day or two, out if you could find a place. They could spend a day or two with a medical assistant somewhere. And so you can, still do that class either in that order. You could do health science, then medical assisting, then clinical internship. That would be good. Or you could do health science, therapeutics, and medical assisting. And that would also be good, I think.
I know what to do now. Thank you very much.
Okay, good.
Thank you.
Yeah, you're welcome.
Hey, Sloan, this is Kim.
Hey, Kim.
How are you?
I'm all right. How are you?
Good. Hey, honey, what would be the recommended path for the MA? Should it be like health science, then medical therapeutics, then AMP, then ICE, or what do you recommend?
Oh, so did you say for medical assisting?
Yes, ma'am.
Okay. If in a perfect world you could have them for 4 years, then I would think about doing either health science, the medical assisting course, and maybe the clinical internship and the anatomy kind of at the same time. I think if you do medical assisting, then you do anatomy, and then you do internship the next year, you've kind of spread out. There's too much time between the course, the medical assisting course, and the end. If you can flip anatomy to the 10th grade, which I know a lot of people disagree with, but a lot of schools actually do it and they do well. So you could do that too. So you don't have to do therapeutics to get the students to that medical assisting test.
Okay.
That does not have to be in the scenario at all.
Okay. Thank you.
All right, about 1 more minute. Anybody else? Okay, I think did I see Christina pop in? Are you
Yes.
still here, Christina? Are you doing a session this time?
I am not.
Okay. Do you have anything you want to say since you're in here?
Oh goodness. Yes, watch for an email from me. I am going to host something very similar to this so that we can discuss what this year looks like. Because unfortunately, I think we do need to put virtual events and opportunities at the top of our radar, at least for the fall. So I will be sending out an email. If I don't have your email, or if you don't have my email, I would send it, let me think, I'll type it over in the chat so that you guys can see it.
Okay, we're going to wrap it up, and Owen's going to give you the code word for your session, and then we're going to jump over to our other session. Thanks for coming.
Yep, so thank you all. So your keyword is Utah, the state Utah, capital U.
All right, bye everyone. I miss seeing you.